Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today is Dr. Jacob Teitelbaum. Now, according to Dr. Teitelbaum, chronic fatigue syndrome and fibromyalgia in children is not a new phenomenon. What is new is that perhaps it's finally starting to be recognized by their physicians. And he's in studio today with us to talk about chronic fatigue syndrome, fibromyalgia, the link between the two, and treatments. How are you doing today, Dr. Teitelbaum?
Excellent. Always a pleasure to be with you, Neal.
Thank you. We're talking about chronic fatigue syndrome in children and in teens. Why do kids, they're kids, why would they be chronically fatigued?
If you take a look at it, this illness represents an energy crisis where the person essentially trips a circuit breaker, or for the older doctors, blows a fuse. If energy demand outstrips the ability to make energy, things will go offline. And the first area that goes offline is called the hypothalamus. It's a control center in the brain that uses an enormous amount of energy, about the size of an almond. It controls sleep, hormonal function, autonomic function, and temperature regulation. That's a lot in a small area. And that's why it goes offline first when you don't make enough energy. So if you take a look at why we have the perfect storm for human energy crisis in our children as well, look at diet. We have 18% of our calories coming from sugar. That's added to the food beyond what normally has been in the food for the last thousands of years. That's 18% of calories wiped out. We've got another 18% white flour. We've got all these added things that really have been stripped. So about half of the nutritional value of the diet, except for calories, has been wiped out in food processing in recent decades. This is why we're seeing kids that are obese and malnourished at the same time for the first time in human history. We're seeing increased speed of modern life. When I was a kid, you wanted to communicate by long distance. I was just like, wow, this whole new thing. Or, and wanted to send a letter. I'm not old enough that you needed the Pony Express, but, it took a while to get a response. It wasn't like click and then click back 5 seconds later with a response. The speed of life is increasing. And also, we're turning, sadly, more and more into almost a fear-based society where it was okay for kids to smile at their neighbors and the rest in the past. Well, now we're teaching both the media and the rest to be afraid, be afraid of everything. It's kind of the old saying, fear sells. That's the media mantra these days, and it's taking a toll on our kids.
Now, you're talking about kids being obese and malnourished at the same time. Have we just been sold a bill of goods as far as, I thought that calories, that equals energy. Everything else was kind of to, make the body, do what it's supposed to do. But when it came to energy, I thought it was calories. And you're saying that, no, that it's much more than calories.
We don't have a problem with inadequate calories. We have a problem with inadequate vitamins and minerals and other nutrients.
All of these that have been taken out of the foods.
Gasoline helps a car run, but you don't want to drive the car into a swimming pool and full of gasoline and soak it. it just doesn't work. Yeah. So we're seeing the problems with it. And also, the sugar is causing immune dysfunction. You can suppress the immune system by 30% for 3 hours with one can of soda. A 12-ounce can of soda has about 10 spoons of sugar in it. So we're seeing a lot more in the way of infections, zinc deficiency, especially important nutrient for immune dysfunction. So many of these kids now are getting infections that they're not able to recover from. These are not dreaded infections. They're things like mono, HHV6, CMV, HSV1, common viral infections, and even other opportunistic infections, candida overgrowth, enteroviruses, that the body just has trouble recovering from because the immune system energetically, that child is on the edge, and they get what's called post-viral fatigue.
Wow.
Or CFS.
Is there more incidence in boys or girls when it comes to CFS, or is it pretty much even across the board?
2 to 1 female.
2 to 1 female.
And this is
the study in the UK. Did it focus on the higher prevalence in females, or is this something that you've discovered in your research and travels?
Oh, this was seen in the UK study and has been seen in dozens of studies, including the studies we've published. It's a common thing that you'll see that for diseases that affect immune function, things like autoimmune diseases, like lupus, for example, rheumatoid arthritis, MS, these illnesses more often affect females than males. a woman's immune system is built differently than man's. They have to be able to carry a baby to term, or, we have one of those little buggers, and that's rejected outright.
Mm-hmm.
And that creates certain strengths, but also certain vulnerabilities. So you'll see from most immune illnesses, they tend, not all, but most, to be female dominant. Unfortunately, what we also see for illnesses that affect predominantly females is that historically, every one of those diseases I mentioned used to be attributed to being hysterical paralysis for multiple sclerosis. Lupus used to be considered neuroses, and that's what happened to CFS. But fortunately, we're now getting past the dark ages. The research is very clear that these are real and devastating illnesses.
Now, is there a link between chronic fatigue and fibromyalgia? I mean, often I hear people who are depressed experience chronic aches and pains. Is it the same with CFS?
Well, depression is very, very different. And if you look at the biochemistry of the two conditions, for example, cortisol levels are elevated, and depression tends to be on the low side.
Mm-hmm.
In CFS and myalgia, immune system change is markedly different, and the response to different treatment is very different. They're very different illnesses. The reason people these illnesses are called depression attribute it directly back to lack of education among physicians. We've done the same in the past. If you didn't know what's wrong with a person, they must be depressed. So these are very real illnesses that are going on. The difference between chronic fatigue syndrome and fibromyalgia, I like to tease. If you go to your infectious disease doctor with a condition, you'll come out to the diagnosis of CFS. If you walk down the hallway to the rheumatologist, you'll come out to the diagnosis of fibromyalgia. For the large majority of people, these are the same illnesses with two different names.
So let's talk about the treatment of CFS. If it's so different from depression and often diagnosed as depression, or just being lazy, what is the treatment for it? And have people been treated almost, to I guess, tragic ends because of misdiagnosis?
Well, as with any disease, if you don't even know it exists, it's hard to diagnose it. If it's hard to diagnose it, good luck trying to treat it. But if you know how to diagnose it, it's very easy. If the person comes in and they say, "Doctor, I'm exhausted," or "I hurt all over," ask them one simple question. Can you get a good night's sleep? If they say, "Oh, God, no, I can't. I can lie there all night. I have horrible insomnia," you can ask, "Do you have brain fog?" And they'll say yes. And then if you're worried about depression, ask them, "Are you depressed?" If they are, they'll say yes. But depression doesn't exclude fibromyalgia any more than it excludes having cancer. But if you have widespread pain and exhaustion combined with insomnia, you have this condition. It's an energy crisis. And our published double-blind placebo-controlled research shows that if you treat with what we call the S.H.I.N.E protocol, optimizing sleep, hormonal function, infections, nutritional support, and exercise as able, don't overdo it or they'll crash and burn, you'll see 90% of people will improve with an average 91% increase in quality of life. These are very, very treatable conditions if you simply treat them correctly.
Diet is often a very hard thing to change, overnight. Do you recommend supplements as you improve your diet?
Well, I think it's a good idea for most people to take a good multivitamin. And, the argument says, well, 500 years ago, nobody took multivitamins. That's because they didn't need them. But nowadays, the change in diet from 500 years ago is that we have 18% of calories now added from sugar, 18% from white flour, and with added fats and other things, we've lost 50% roughly of the vitamins and minerals and other key nutrients except the calories in our diet. So I do recommend the multivitamin I like is a vitamin powder. It's called the Energy Revitalization System. One scoop a day replaces 35 pills, and it's really pretty complete in terms of nutrients, A to Z. What it doesn't have would be fish oils and iron, but otherwise it really has what people need, and it keeps it simple. This way, that piece is covered. We have 2 studies now that adding a special nutrient called ribose increased energy an average of 61% in people with chronic fatigue syndrome and fibromyalgia after 3 weeks. That's an easy one to get the kids to take because it doesn't taste like sugar.
Well, no problem there.
There's a lot that can be done easily.
So where can our listeners go and get more information about you, your research, the UK study, fibromyalgia, and CFS in general?
There's a website, www.end, that's E-N like Nancy, D like David, fatigue.com. There's, you can see the copies of the studies are available on the website. There's also a free energy analysis program where people can go ahead and actually the patient can take quizzes, they can put in their pertinent lab tests, the doctor can do it for them. We can print out, we'll have to send out copies of treatment protocols and questionnaires for physicians and health practitioners that are interested in treating this illness. And they can contact me at the Q&A on the website. But once you do the energy analysis program, it will print out here are the likely things contributing to the energy loss, which is the foundation of CFS and fibromyalgia. Here are the things to optimize energy, both by natural over-the-counter and also prescription therapies. So it will really tailor a treatment protocol to optimize energy that the physician can use. In addition, we consult with people from all over the world, and many people are too sick to come in person, so we do the phone consultations. It's nice and web telemedicine these days. And we do a 3-hour, 4-hour assessment of each case to really put together a very thorough treatment protocol so that these people can get well.
Great information. You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio talking with Dr. Jacob Teitelbaum, director of the Practitioners Alliance Network, also the lead author of 4 studies on effective treatment of fibromyalgia and chronic fatigue syndrome, and a study on effective treatment of autism using NAET. Dr. Teitelbaum also appears often as a guest on news and talk shows nationwide, including Good Morning America, The Dr. Oz Show, Oprah and Friends, CNN, and Fox News Health. It's been great having you here with us today, Dr. Teitelbaum.
Neal, always a pleasure.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.